Hi, this is Dr. Kaan. Today I'm going to touch on managing pain and discomfort, navigating pain and discomfort during your ACL recovery process. Because chances are, if you're going through this process, you have come across pain or discomfort, stiffness, some sort of symptom or agitation throughout your journey. Before I get further into that, if you guys are following along with the page and have found the content valuable, please like, subscribe. If you have questions, comments below, please drop them. We get to almost every single one. And of course, if you have a fellow ACLer that could benefit from these tips and education, we drop a new video every Monday here on our channel. So, topic that I haven't touched on yet, really, I think it's important to address and talk about is the experience of pain and discomfort as you go through this process. And there are times in the beginning, in the early stages, middle stages, and even late stages where you may experience pain or some sort of discomfort from time to time. In the beginning of the process, we're talking about post-operative pain, right? You just had surgery, drilled holes in your leg, they cleaned stuff out, they cut a piece of your tissue and they used it as a new ACL. So a whole bunch of things has occurred and happened, and people will get pain and discomfort shortly after the surgery. And you wake up, and the nerve block wears off, and then the pain starts to kick in. This pain may last anywhere from 7 to 10, 12 days as things heal. And this is not from the injury itself. This is actually from the surgery. So we do call this post-operative pain. This is very, very common and normal. And the way that we navigate pain like this, number one, is listen to the doctor, take the pain medications as prescribed. If you're in so much pain, you're not going to want to move. And a key part of this rehab process and getting going and helping with that pain and discomfort and moving on with the rehab process is actually moving the knee. And if we can't do that because we're in so much pain, then we're going to fall behind. And we're going to probably have more pain and discomfort because of it. Number two, stay off your feet early on. The knee is already stressed. There's already swelling going on because the body's trying to recover and repair everything it's been going through. If we're on our feet more, we're going to stress more, which is going to cause the knee to be more of a balloon, and then they're going to cause swelling in other areas, lower leg, calf, ankle. So get off your feet, get the leg elevated, get it compressed. This will help with the swelling, and which in turn will help with the pain itself. And then number three, get going with your recovery, your rehab exercises, right? You should have a program and stuff to do, a structured routine day one if you can. And it doesn't have to be a laundry list of things, just a few things to get the needle moving. And these are important as you start to go along. As the post-operative pain wears off, well, then you're getting on with the rehab process. There are other things that can cause pain. Early on, we're trying to get range of motion back. So that's both extension and flexion. People will also struggle with how much to push because at those end ranges or whatever range of motion they have, they will experience discomfort and pain. Now, the way that we explain it to our clients is we don't want to forcefully push the knee, right? If we're working on flexion, for example, and you're getting to about 80, 90 degrees and you're in some pain, what you want to tell yourself is, well, can I label this pain? Two ways. One is describing it, right? Is it achy? Is it sore? Is it sharp? So this will give us an indication of what it feels like. And number two, what's the intensity of the pain? And so if you had to put a number on it, 0 to 10, 10 being the most imaginable pain you've ever experienced, 0 being no pain, well, where does it fall on that scale? And then after you stop the motion, the stretching, well, how long does that pain linger? These are the three factors that I usually look at when talking about pain and how to modify it and how to push and how to hold back, okay? So when we describe the pain or what it feels like, if it's sore, if it's achy, these are things that it's okay to kind of nudge into, lean into that. If it's very, very sharp and intense, these are pains that I would most likely back off of. On a number scale, 0 to 10, if we're below, let's say, a 3, 4, these are okay to kind of nudge and push those barriers. If anything is above a 5 or 6, these are things that I would back off of. So these are two ways that I go about pain, especially when we're working with motion and trying to get more and more. The other thing that I mentioned was how long does it linger for? So after I stop my flexion or stretching exercises, well, does it go away right away within minutes, or is it lingering for an hour or two or even longer after? It's another thing that I like to be wary of. When we're stretching, you should experience some discomfort, especially as you're getting to those barriers. Keep it below 3 or 4. It should go away minutes later, half hour later tops, right? That's how we know we are pushing just enough. If we push too much, right, we're going to experience prolonged pain that's going to linger and last. It's going to be intense. The other thing that may happen is we may get an effect of swelling in the knee. When we stress it, when we push it too much, we irritate it, we try to forcefully bend it, we may over-irritate it. So we have to be mindful of that. So when we're working on range, a few things that I touch on, especially when we're talking about pain, how much to push, keep pain below 3 to 4. If it's sharp, shooting, and a high intensity, these are pains that we back off of. If it's deep, achy, sore, up below 3 or 4, we can kind of nudge into those barriers. Then we also want to monitor after. Does the pain go away within minutes, half hour, or is it lingering? And then lastly, is there any swelling from the work that we did? Is it intense enough to cause the knee to swell more than from its baseline? So if you can follow those rules of thumb, it really can go a long way and can help you as you're pushing and navigating, trying to regain that full range of motion, which is foundational work. Second part where people experience pain is as we're doing strength training, okay? As we're trying to build the muscles, a common complaint that we can get is like, well, I don't feel the exercise in my muscles, I feel it in our knee. Usually when we assign specific exercises for strength, particularly let's say if we're working the quad muscles, we want our patients to feel it in the quads. So a question that we would ask is, where do you feel it? So a question you could ask yourself is, where am I feeling this exercise when I'm doing it? So let's say, for example, you're doing a leg extension exercise, right, which is an isolated exercise for the quads, which we use very much here at the ACL Academy early and often. And if you're doing this exercise, let's say you picked a weight and as you're doing it, what you're asking yourself is, where do I feel it? Do I actually feel it in the quad muscle where I should? Do I just feel it in the knee? Do I feel it in both? Okay, that'll give you an idea. If you just feel it in the quad, that's great. Have at it. Maybe you could even increase the weight. If you're feeling it in the quad and the knee itself, okay, again, wouldn't back off right away. But my next question, similar to the range of motion is, well, what does it feel like? And what's the intensity of it? And does it stop and linger after the exercise? And does it cause swelling, right? You're going to ask the same questions. If it's sharp and achy, sharp and shooting in the knee joint itself, and it's intense 5, 6, well, that's way too much. If it's a low level 2, 3, and maybe it's a little achy in the knee, but I feel it in the quad, well, okay, those are things that I would suggest you work through. So minimal pain is okay. We're actually building stress tolerance to the knee itself. So I don't usually back off from that. I tell our clients to work through that. But again, it's other factors, right? As long as it's not sharp shooting, as long as it's not lingering after, as long as it's not causing more swelling after the activity, and that swelling is lingering and staying for a day or two or more. So that's an idea. So if you're doing the exercise, you just feel in your muscles, that's great. Push through, add more. If you're feeling it in the knee joint and quad and the muscle at the same time, it's kind of get an idea of like, oh, what's the level of pain? What's the number? What's the descriptor? If it's low level, it's just deep, achy, sore, you can push through that. And lastly, if you don't feel in the quad muscle at all and you're feeling directly in the knee joint, well, how can we modify this exercise? So you say you're doing a knee extension exercise. Again, you say to yourself, well, if I'm at a higher weight, can I lower the weight and see if I can get a burn? Okay, that's the first step. Second step would be, okay, still lower the weight, didn't work at all. Okay, can I limit the range? So instead of going from, let's say, 90 degrees to 0 degrees, can I go from 90 to 45? Limit that range that way. Can I feel it mostly in my muscle? And if that works, great. If that doesn't, okay, how can I even backtrack even more? Well, I will do what we call isometrics, where we push at 90, we don't move, and we're holding that contraction there. And then we may increase the range at 60 degrees and then push there. So we're doing the contractions, we're generating muscle force, but we're not moving through the motion. So there's so many ways we can break down an exercise so you can feel it in your quad. But a general rule of thumb here, especially at the ACL Academy, we talk to our clients, you're going to feel some pain and discomfort along this process. So what's okay pain to work through, and what's pain to stop? So really, the general rule of thumb, intensity of pain, 0 to 10. Anything below 3 or 4, you usually generally say. If it's 5, 6, or higher, these are things that I would be a little bit more worrisome of and it would cause us to ask more questions, be more curious about it. So you should ask yourself, well, what does that pain feel like? Sharp shooting, I don't like. Deep, achy, sore, okay. Again, if the intensity is on the lower end. And then after you stop the activity, what we're looking at is, does it go away, okay, immediately or short thereafter, or does it linger? Okay, if it's lingering for hours, a day, or lingering and causing swelling in the knee joint, that's even something more that I'm more cautious about. So those are the things that I would stop, back off, modify, or see if we could change, right? Can we change the way we're doing a certain exercise? Can we modify it a little bit, whether it's the weight or it's the range or the way that we do the exercise? So there's always modifications where we can continue to move forward. But what I want people to understand is sometimes the knee has to go through some discomfort, because that's what builds the resiliency. So you will have pain as we're working into new ranges. You will have some pain and discomfort as we're doing new exercises or as we're adding weight to new exercises. You will have some pain and discomfort as you start agilities or plyos. So let's say power development, jumping, hopping, change of direction. So when you get on the field, the knee is experiencing new things. So it's gonna have some discomfort. Body's going to be like, whoa, we haven't done this in a long time. Are you sure this is okay? So it's just a way of your body responding and protecting itself and keeping an eye on the knee, because that's its job. So your job is to slowly expose your knee to these new stresses because you want to build up to the demands of your sport. So as we go through new exercises, stress on the knee, such as running or starting agilities or starting a jumping program, we have to understand that our knee may go through some discomfort, and that's not necessarily a bad thing. It's just finding a way to modify things if we need to, or understanding that low levels of pain are okay. And as our knee gets stressed the right way, it's going to build the resiliency that it needs. Hope that makes sense and gives you guys some good feedback and understanding of pain, discomfort, and what to push through and what to hold back on. Because as you navigate this process, these things will come up. If you have questions, drop them below. This is Dr. Kaan signing off. As if you found some value, please subscribe to our channel. Please like the video. And more importantly, share with a fellow ACLer that can benefit from these tips and education. We drop a new video here at the ACL Academy every Monday.